The scenario you just saw is exactly what happened to one of our senior center members. In her own home, in her own bathroom, on the floor, she had a bath mat that had no rubber backing on it. As a result, she slipped and fell, fracturing several bones, and had to have surgery.
One in every 3 adults, 65 and older, will fall each year. And falls are the most common cause of death from injury among older adults. By the time we're 80, 1 in every 2 of us will experience a fall. Now, to demonstrate just how common it is for older adults to fall, we checked with the fire department. Between 2006 and 2008, the fire department here in the city of West Allis responded to almost 900 calls a year, each year. That's about 2.5 calls a day. So now you know why we're going to talk to you about the common causes of falls among older adults and provide you some tips to try to prevent them from happening. Common causes for falls among older adults range from items in your environment to your physical well-being. For example, something as simple as lighting can play a huge role in trying to prevent falls. Dimly lighted stairs, hallways, and rooms can hide items just waiting for somebody to trip over them.
There are many items in your home that are the most common causes of in-home falls. For example, inadequate lighting in hallways and on stairs, slippery rugs and carpets, especially in bathrooms and kitchens, step stools that are old, rickety, and unstable. Clutter on floors and stairs provides the perfect condition for a fall to occur. Furniture placement that blocks pathways, loose-fitting clothing that drapes on the floor or could catch on objects, slippery socks and slippers, and rushing around or making quick turns.
Now, besides our environment being a factor in causing falls, our physical well-being is also an important aspect of falls and preventing them. It's a fact of life that as we age into our senior years, we develop physical limitations. We do, but those physical limitations make us more susceptible to accident and injury.
Common health conditions can increase our risk to falls. Any acute or chronic health condition can increase the risk. And also, normal aging changes to our vision, hearing, or muscle strength can cause a problem. Some specific health problems that might cause a problem include any condition that results in decreased muscle strength, vision problems such as cataracts or glaucoma, balance problems such as vertigo or inner ear problems, health conditions with tremors such as Parkinson's disease, or any heart or brain condition such as blood pressure or stroke problems. The most important step is to have regular checkups and to take good care of yourself.
Many of these common causes, especially when it comes to your environment, can be prevented. Remember what we said about inadequate lighting?
You know, almost half of all falls happen at home. So you really need to take a look at your living environment to be sure that it's safe and hazard-free.
Now let's talk about some of the ways that we can make your home a safer place. Let's start with the lighting. It's important to keep your stairways and hallways well lighted and to use a night light in the bathroom and bedrooms. Use non-slip rugs and carpetings in the house. Use a sturdy step stool with handles.
Now in the kitchen, if you're short like me and you need to use a step stool to get to the higher cabinets, why don't you just take the things that you use more often and move them down so you don't have to climb up to get at them?
And clear clutter from walkways and stairs. For example, keep electrical cords, magazines, and telephone wires out of the way. Install grab bars in the bathroom and use non-skid mats in the shower and bathtub.
Here's a really good tip. Use that soap on a rope. Don't bend or reach for your soap. Put a bar of soap in a nylon stocking with one end tied and put it on the towel bar. That will help you to find it so that you're not moving around and slipping.
Arrange your furniture for easy access and movement. Wear proper fitting clothes, low-heeled shoes, and non-slip soles on your socks and slippers. Take your time, don't rush around the house, and avoid making sharp turns. And just in case, think about obtaining an accident alert device. This is a device that you wear on your wrist or around your neck, which allows you to call for help when a button is pressed on the device. But remember, there is a cost involved with an accident alert device. An alternative is to have a network of family or friends to keep in contact with on a regular basis.
So take a look around your home. Search for items that could potentially cause you or someone else to fall, and then remove them. Now, as for your physical well-being, well, that's going to take a little bit more effort.
Exercise is a great way to improve your strength and balance, and it's never too late to start a new program. But remember to always check with your doctor before starting any new exercise program. Especially beneficial are exercises that strengthen the muscles for walking and lifting. In addition, balance exercises can improve your stability.
So we have to be flexible in our movement patterns in order to be able to meet the demands that the environment places on us.
If balance is a problem, though, you may want to consider using a walking aid such as a cane, walking stick, or walker.
Falling occurs when people aren't healthy. It's not a normal part of the aging process to be experiencing falls.
It's also important to have your eyes checked yearly for vision changes, such as cataracts, glaucoma, and other eye problems. It's important to let your doctor or pharmacist know if one of your medicines is causing you to feel dizzy or to lose your balance, as this information will help them provide better care for you.
The question that needs to be answered isn't, are you okay? It's, why did you fall? What is the underlying source of the falls? Your physician, your physical therapist should be consulted to help you develop an individualized plan that reduces your risk for further future falls. The plans to prevent falling are as unique as the individual who is experiencing falls.
Once you fall, you can lose your independence. You will be prone to falling again. You could develop a permanent disability, chronic pain. You could become dependent upon others for helping you with the simplest of daily activities. Remember what we said earlier? Falls are the most common cause of injury death among older adults. But they don't have to be. Falls can be prevented, and that will allow us to safely enjoy our golden years.